And the first question that we're referring to here is Dr. Orrin Davinsky. He's a New York neurosurgeon. And he asked this question of President Obama: if your wife or your daughter became seriously ill and things were not going well, and the planned physicians told you they were doing everything that could be done, and you sought out opinions from some medical leaders in major centers, and they said there's another option that you should pursue, but it wasn't covered in your plan, would you potentially sacrifice the health of your family for the greater good of ensuring millions, or would you do everything possible as a father and husband to get the best health care and outcome for your family? Let me translate the question. A neurosurgeon asked Obama, okay, you've got a health care plan. You've got the health care plan that you're going to prescribe for everybody else. Your wife or your daughter comes down with a major illness. Your plan goes through the diagnosis. And then you find out that there's some other doctor out there somewhere with another procedure and another form of treatment, another opinion, but your plan doesn't cover it. Are you going to stick with the plan you forced on everybody else? Or are you going to use your wealth and go outside the plan to get the treatment for your wife and daughter that other people are not going to be able to do because they don't have the money? That's the question. He did not answer it.
You're absolutely right that if it's my family member, if it's my wife, if it's my children, if it's my grandmother, I always want them to get the very best care. But here's the problem that we have in our current healthcare system, is that there is a whole bunch of care that's being provided that every study, every bit of evidence that we have indicates may not be making us healthier.
All he did there was say, admit, yeah, I want the best health care possible. Well, so the hell does everybody else. That wasn't the question. The question was, are you going to go outside the plan that you have prescribed for everybody? See, the dirty little secret is, he's going to be exempt from the plan, as are all members of Congress. The question was a good one. You're going to go outside the plan? If you find a better doctor, better treatment your plan doesn't cover? Well, you're right. I'd go get the best care I could. I want the best care. Then comes this irrelevant, non sequitur answer that we have a bunch of care that's being provided indicates may not making us healthier. That, folks, I'm telling you, the answer to this question you need to focus on, Obama is looking to cut health care. He's looking to cut it because that's the only way he can keep costs where they are or reduce them, which is not going to happen anyway. We have the best health care system in the country, and he's going to restrict access to it as a means of saving money. That's the only way you can do it. So we wouldn't answer the good doctor's question. The answer to the question is, for President Obama, yeah, I'm going to use the wealth I've acquired, and I'm going to go get the best treatment I can. But the vast majority of Americans will not be able to do that because they aren't going to be able to afford it. They're going to be stuck in a plan that doesn't cover everything they might need. And Obama's answer is, well, maybe you don't need the treatment. Maybe you don't, quality of life is such, you don't need it anyway. We'll save money. Next question. Member of the audience, Jane Sturm. My mother is now over 105. But at 100, the doctor said to her, I can't do anything more unless you have a pacemaker. I said, go for it. She said, go for it. But the specialist said, no, she's too old. But when the other specialist saw her joy of life and so on, he said, I'm going for it. That was over 5 years ago. My question to you is, outside the medical criteria for prolonging life for somebody who's elderly, is there any consideration that can be given for a certain spirit, a certain joy of living, a quality of life, or is it just a medical cutoff at a certain age?
I don't think that we can make judgments based on people's spirit. That'd be a pretty subjective decision to be making. I think we have to have rules that say that we are going to provide good quality care for all people. End-of-life care is one of the most difficult sets of decisions that we're going to have to make. But understand that those decisions are already being made in one way or another. If they're not being made under Medicare and Medicaid, they're being made by private insurers. At least we can let doctors know, and your mom know, that, you know what, maybe this isn't going to help. Maybe you're better off not having the surgery, but taking the painkiller.
Folks, do you realize how cold and heartless that answer is? This woman is asking about her mother. And everywhere she went, except one doctor, refused to put in a pacemaker. She's too old, she's going to die anyway. Found a specialist. Hey, this woman really loves living. I'll put it in there. He's lived 5 years with the pacemaker. And still, Obama says, maybe you're better off is to tell your mother to take a pill, take a painkiller. See, we have to have rules. We have to have rules. Your mother should have died 5 years ago, lady. She'd have been better off taking a painkiller. Who says we have to have his rules? The President of the United States is not a king. He's not an autocrat. He's not a ruler. He doesn't get to set the rules. Obama has taken it upon himself to do so. This woman found a way to get her mother a pacemaker. With Obamacare, you just heard the answer, it wouldn't have happened. I know how this stuff works. The hospitals are under pressure to free up beds. If they think somebody's terminal, get them out of there. And so I understand how all this works, but we're not talking about a terminal woman here. We're talking about a woman who needed a pacemaker. I don't think we can make judgments based on people's spirit. That'd be a pretty subjective decision to be making. Maybe not if the government's in charge. That's the whole point. What about if families? Do not families have a right to judge the spirit of their mothers and fathers and family members? Of course. Do we want a cold, cruel, unfeeling government saying spirit doesn't matter to us? That's exactly right. Obama wants you to... the best way to put it, and it's working, he's trying to kill spirit. All this hope and change, he's trying to kill it. You know how many frustrated Americans there are out there at what's happening? This Sanford business, I'm going to tell you one of the first thoughts that crossed my mind with Mark Sanford. This was the first thought. What he did defies logic. This is more than being 180 degrees out of phase because of lust or love. To split the scene for 5 days. And we know he's been separated. And he knows, by the way, that the newspaper in his state has the emails between him and his concubine down there in Argentina. He knows this. He knows that somebody knows what's going on. He knows his wife knows. So he ups and leaves for 5 days, doesn't leave anybody in charge of the state in case there's an emergency. This is almost like, I don't give a damn. Country's going to hell in a handbasket, and I just want out of here. He had just tried to fight the stimulus money coming to South Carolina. He didn't want any part of it. He lost the battle. He said, what the hell? I mean, the federal government's taking over. What the hell? I want to enjoy life. One of the first things I thought. Now today he's saying he don't want to give up office. He wants to stay in office, but I mean, even Charles Krauthammer said, well, this is like self-inflicted political suicide. And it certainly appeared to be. The point is, there are a lot of people whose spirit is just, they're fed up and to hell with it. I don't even want to fight this anymore. It's just because I just want to get away from it. And here's Obama admitting, well, we can't start make judgments based on people's spirit. Imagine if we had presidents in the past so we couldn't make judgments on any number of political issues using people's spirit. You know, it's the American exceptionalism, the spirit of can-doism that built the country. The spirit's everything. Energy, desire, get up and go, ambition. The woman's mother had an ambition to live. She just needed a pacemaker. Didn't matter. She should take a painkiller. I'm telling you, this is a cold-hearted, ruthless guy. Not a cool, calm, and collected one. Brief timeout. We'll be back and continue after.
Rated the #1 talk radio personality of all time, Rush Limbaugh, on the EIB network. Now, an urgent global warming message from Albert Gore Jr.
The more we study global warming, the more we learn. Take cow flatulence, for instance. Recent studies have shown that the abundance of gas from cow flatulence is more dangerous than automobile emissions. So right here on my Tennessee farm, we're studying new holistic farming methods to reduce cow flatulence.